Welcome to our channel, Health and Hygiene. Today we will delve into the fascinating world of artificial reproductive techniques. These methods have transformed the landscape of reproductive medicine, offering hope to many individuals and couples struggling with infertility. Let's explore the various techniques, their processes, and their impacts. Artificial reproductive techniques, or ART, encompass a variety of medical procedures used to address infertility. These methods include in vitro fertilization, or IVF, intracytoplasmic sperm injection, also known as ICSI, and more. Let's begin by understanding the basics. In vitro fertilization, commonly known as IVF, is one of the most well-known ART methods. It involves combining eggs and sperm outside the body in a laboratory. Here's a step-by-step overview of the IVF process. Ovarian stimulation. Hormonal medications stimulate the ovaries to produce multiple eggs. Egg retrieval, a minor surgical procedure, retrieves the eggs from the ovaries. Sperm collection. Sperm is collected from a partner or donor. Fertilization. Eggs and sperm are combined in a laboratory to facilitate fertilization. Embryo culture. Fertilized eggs develop into embryos in a controlled environment. Embryo transfer. One or more embryos are transferred into the uterus. Pregnancy test. A blood test confirms pregnancy about 2 weeks after the embryo transfer. IVF has helped millions of couples achieve their dream of parenthood. However, it is important to understand that success rates can vary based on factors like age, the cause of infertility, and overall health. Intracytoplasmic sperm injection, or ICSI, is a specialized form of IVF used primarily in cases of severe male infertility. In this technique, a single sperm is injected directly into an egg. Let's look at the ICSI process. Egg retrieval. Similar to IVF, eggs are retrieved from the ovaries. Sperm collection. A single sperm is selected for injection. Sperm injection. The selected sperm is injected directly into the egg. Embryo culture. The fertilized egg develops into an embryo. Embryo transfer. The embryo is transferred into the uterus. ICSI can significantly increase the chances of fertilization, especially in cases where sperm quality or quantity is an issue. Donor eggs and sperm are often used in ART when individuals or couples cannot produce viable gametes. This option allows for a broader range of possibilities and can be particularly beneficial in the following scenarios. Used when a woman cannot produce healthy eggs due to age, genetic conditions, or ovarian failure. Used when a man has no sperm or severe male infertility that cannot be treated. Using donor eggs or sperm involves careful screening and matching processes to ensure the best possible outcomes for the intended parents and the child. Surrogacy is an ART method where another woman, the surrogate, carries and delivers a baby for the intended parents. There are two types of surrogacy, traditional and gestational. Traditional surrogacy. The surrogate uses her egg and is artificially inseminated with the intended father's sperm. Gestational surrogacy. The surrogate carries an embryo created through IVF using the intended parents' or donor's gametes. Gestational surrogacy is more common as it allows the intended parents to have a biological connection to the child. Surrogacy involves complex legal, religious, and emotional considerations, and it's important to work with professionals throughout the process. Preimplantation genetic testing, or PGT, is a technique used to screen embryos for genetic disorders before implantation. This testing helps ensure the transfer of healthy embryos and can be particularly useful for couples with a history of genetic conditions. Checks for chromosomal abnormalities, screens for specific genetic disorders, detects structural chromosome rearrangements. PGT can increase the chances of a successful pregnancy and reduce the risk of genetic disorders in the offspring. Cryopreservation involves freezing and storing eggs, sperm, or embryos for future use. This technique offers flexibility and additional options for individuals and couples planning their families. Cryopreservation is commonly used in the following scenarios. Egg freezing, for women who want to delay childbirth or preserve fertility before medical treatment. Sperm freezing, for men undergoing medical treatments that may affect fertility. Embryo freezing, for couples with extra embryos after an IVF cycle, allowing for future embryo transfers. Cryopreservation has become a vital tool in reproductive medicine, providing more opportunities for family planning. Undergoing ART can be an emotional and psychological journey. It's essential to be aware of the potential challenges and seek support when needed. Here are some tips for managing the emotional aspects of ART. Seek counseling. Professional counseling can provide valuable support and guidance. Join support groups. Connecting with others going through similar experiences can be comforting. Maintain open communication. Keep lines of communication open with your partner, family, and friends. Practice self-care. Prioritize activities that help reduce stress and promote well-being. Navigating the emotional landscape of ART can be challenging, but support is available, and you are not alone. In conclusion, artificial reproductive techniques offer hope and solutions for many individuals and couples facing infertility. From IVF and ICSI to donor gametes and surrogacy, these methods have revolutionized reproductive medicine. Understanding the options available and seeking professional guidance can help you make informed decisions on your journey to parenthood. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more health-related content. If you have any questions or thoughts, feel free to leave a comment below. Stay informed and take control of your health.